Hello everyone, this is Dr. Swati Mukherjee from the Department of Psychiatry, District Hospital, Jabalpur. We all know that the pandemic has raised its ugly head all over again, resulting in a state of panic amongst most of us because the second wave seems to be more fatal and affecting a wide variety of population this time. So everyone is going through a period of a lot of anxiety, worry, and stress. So, today I'm here to tell you that instead of just focusing on the physical aspect of this disease, focusing on the mental aspect and looking after our mental health and seeing to it that we are mentally stable is equally important because it is going to help us to, prevent ourselves from being infected as well as recovering faster and returning to normal life faster. First and foremost, my first suggestion would be that stop paying attention to the overload of knowledge which is being circulated on, say, WhatsApp, Twitter, or other social platforms. That really adds to the anxiety and the fear because nobody really knows how much of truth there is in these messages. So refrain from also discussing these topics with your friends while chatting or when you are with family members or at your workplace because as it is, the entire atmosphere is only COVID, COVID, COVID. So we do not need any more of this to stress us down. Also, it is important to try and lead a disciplined life as much as is possible in these circumstances. So, including a little bit of exercise in your daily routine, taking adequate rest. By adequate rest, I don't mean sleeping, 10 to 12 hours or so, but quality rest where you get rejuvenated, where you are refreshed, where your body is able to again cope up with the situation. A very good diet which gives you the energy to think well and to combat the situation in the most appropriate manner. Maybe meditation, maybe indulging in a hobby which releases the positive hormones which help you to stay upbeat. Then watching movies or indulging in anything that distracts your mind from this current scary situation. That will probably help you to gather yourself up and be more capable of combating the situation. So, this way, if on a regular basis we work towards positivity, we work towards stabilizing our mental state, then I'm very sure that even if at any point of time any one of our family members or anyone who we are close to is diagnosed with COVID positive, we will not hit the panic button. And then we will be in a position to give strength to that patient, give assurance to that patient that nothing is out of control, and we will be able to overcome that situation. But for that, we have to be very, very emotionally strong, and that we can do by continuously building up our life state. Then many a times what happens is that a COVID patient, even after he or she is discharged from the hospital or has completed the period of isolation, still cannot come out of that fright, that the COVID-19 virus had attacked him or her. They are still in that zone of fear and anxiety and cannot come to terms that they are normal now. This is called a psychological trauma, something very similar to a post-traumatic stress disorder. And at such a time, the patient needs emotional support, the patient might need cognitive behavioral therapy, and also maybe sometimes psychiatric medicines also. So whatever the situation might be, it has to be assessed, and accordingly the patient has to be helped to come out of that state of emotional distress after he or she has been discharged as a COVID patient.